Today I'm going to talk to you about burns as it relates to physical therapy. Now, there are your standard first, second, and third degree burns, but the medical community is kind of moving in a different direction as far as how to classify burns. We now have superficial partial thickness, deep partial thickness, as well as 2 different degrees of full thickness burns as a more detailed way of describing exactly what's going on with that burn, how serious that it is. Our interventions are going to be mainly treating secondary impairments that are going to result from the burn, such as contractures, mainly range of motion, any sort of secondary impairments that we could prevent while the person is in that acute phase of therapy in the hospital. It's going to be necessary in order to keep them from developing such things as pneumonia. Now, I'm going to demonstrate how I actually managed my wound care for a burn that I got a few months ago here on this finger, as well as on the palm. Now, as you can see, the palm, it doesn't really look like I had anything. It's healed pretty nicely, but you can definitely see a scar here on the 4th finger. The palm, it never really opened up, so I didn't have to put any gauze or anything on that, but the ring finger I did. And what they gave me in the hospital was some of this stuff, this Silvadene. It's pretty much the gold standard for use as an antimicrobial. Again, this was an open wound. It was open for a couple of weeks, and keeping infection out is very, very important. Now, I also had an OT consult to make sure that I did a few hand exercises to maintain my range of motion in the hand, local grip. Okay, some of these different exercises just to make sure that contractures do not develop, because whenever a burn occurs, flexion contractures, you're wanting to move into more of a flexed position, so it's important that you stretch out everything. Also, depending on the burn, you might end up having more extension contractures. With mine being on the dorsal part of the finger, they were worried about me developing more extension contractures here, and so many of my exercises involved flexing the fingers, balling it up into a fist. So now, I did my own wound care for a few weeks using the Silvadene. Granted, it's closed now and this isn't necessary, but I would take the gauze. Granted, this was sterile in a package. Okay, put some Silvadene on there. Apply that very liberally to the area, and then wrap. Now, unfortunately, I don't have any more of the stockinette, which was very good for keeping all of this in place. However, I do have this, which can be used as well, just to secure that gauze. Now, you want to make sure that it's not too bulky, because again, you're still wanting the patient to be able to move through their range of motion. So it's good to make sure that you still have good range of motion. Alright, I can still flex that finger just fine even with that in place. And I've got some tape here. I can tape it down as well. Again, with this preferably, you don't want to use tape across a joint in this way because it tends to be bulky. That's where the stockinette really comes in nicely, because it makes it to where you don't have to use the tape. I can still bend that. It's a little bit more difficult with the tape there, but it's still functional. And so, again, with therapy, the wound care might be a part of physical therapy, although other disciplines, such as nursing, have kind of taken that over. But you may find yourself applying this sort of a treatment to an area, especially a small area such as that. But some of the same principles that you'll take is that you want to maintain that range of motion if it's at all possible. Now, if the individual has a very serious burn requiring a skin graft, which this did not require a skin graft, the physician did tell me that an area right here was actually a third-degree burn, so a full-thickness burn. However, it was such a small area, they weren't worried about it closing on its own, and it eventually did without requiring a graft. However, still same principles. You want to maintain that range of motion. In the rehab setting, you're going to be taking care of any other impairments that might have developed over time, such as strength deficits. But mainly with that graft, if they have to do a skin graft, then motion in that at that area is going to be contraindicated because you don't want to disrupt that graft, which means later on during rehab they're probably going to have some contractures that are going to have to get worked out. Scar tissue mobilization is also a good manual therapy for trying to break up some of that scar tissue that's developed that could be hindering their range of motion. But basically, as far as the wound care portion of it, again, might not be something that you'll see much of as a physical therapist or physical therapist assistant, but could be something that